Welcome. In this video, we'll walk through key coding steps for radiology X-ray services, covering CPT codes, imaging views, charts, ICD-10 tips, and common pitfalls to avoid. Let's get started. Let's review the CPT code used to report this service. 73590, Radiologic Examination, Tibia and Fibula, 2 views. This includes AP and lateral views of the entire lower leg. Tibia-fibula radiographs are used to evaluate the bones of the lower leg from the knee to the ankle, including the joint spaces. Standard views include AP view, anteroposterior view from the front, covering both the tibia and fibula, extending from the knee to the ankle. Lateral view, side view of both bones, including the knee and ankle joints in profile. Cross-table, lateral view, a modified lateral projection often used in trauma when the patient cannot be repositioned. This view must include both knee and ankle joints. Radiology report, exam order, tibia-fibula 2 views. Right, header, AP and lateral views of the right tibia and fibula. History, injury. Comparison, none. Findings, normal alignment, no fracture. Thickening of the distal fibular diaphysis, possibly related to chronic periosteal reaction or an old healed fracture. No significant soft tissue or bony abnormalities. Impression, no acute fracture or dislocation of the right tibia and fibula. Let's look at the views. AP view, lateral view, that's a total of 2 views. This qualifies for CPT code 73590, right? Radiologic exam, tibia and fibula, 2 views, right. Now, let's choose the appropriate diagnosis code based on the clinical history and chart findings. Report findings state, imaging was ordered for injury, but no acute fracture or dislocation is seen. Radiologic findings note thickening of the distal fibula, which could represent a chronic periosteal reaction or an old healed fracture. To properly code the encounter, coders must review the patient's chart or referring provider documentation to identify the cause of the injury. In this case, the chart review reveals the patient fell, initiated the current evaluation, even though imaging showed no acute findings. The most appropriate ICD-10-CM codes are Z04.3, encounter for examination and observation following other accident. This code is appropriate when the patient has no acute findings, but imaging is performed after a fall or accident, and the purpose of the visit is to rule out injury. This is the correct code when the encounter is diagnostic, only with no confirmed trauma, and the documentation links the exam to an external cause like a fall. Important coding note: when the radiology report is negative for fracture, but the history indicates trauma, such as a fall, use Z04.3 if there is no confirmed injury, and the imaging is purely precautionary or evaluative. Correct codes for this case are CPT 73590, right, radiologic examination, tibia and fibula, 2 views, right, and ICD-10-CM Z04.3, encounter for examination and observation following other accident. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content. CPT is a registered trademark of the American Medical Association, AMA. CPT codes are used in this video for educational purposes only and do not reproduce CPT descriptors in full. This video is not a substitute for the AMA CPT Professional Edition or official coding guidelines. Verify all codes with the most current CPT code set and payer policies before claim submission.